Hi everyone, I am Dr. Vinay Kumar, Orthopedic Consultant at Srikara Hospitals. Today I am going to discuss about knee pains in young age group. Whom do we call as young age? Generally, people below the age of 50 we consider as young age, and nowadays it's more common that people come to us. Out of 100 OPs we see, generally 50 to 60% they come with knee pains. So what are the common causes of knee pains in young age? So let's discuss about that. So there are various causes for the knee pains in young age. Most common is physical strain or excessive physical therapy, and then trauma, sports injuries in young age, and some people in young age they develop rheumatoid arthritis. That is the autoimmune disease in which patient develops antibodies against his own immune system. So what are the common causes of knee pain in young adults? First, let us know about the knee. Knee is made up of thigh bone, which we call as femur, the leg bone, which we call as tibia, and the kneecap bone, which we call as patella. All these structures are covered by a thin layer of cartilage, which is a soft structure, and the knee is also made up of various ligaments and structures, which we call as anterior cruciate ligament, posterior cruciate ligament, the medial collateral ligament, lateral collateral ligament, and there is a structure, a rubber like washer, which we call as menisci, between the two bones, which acts like shock absorber. So when a person strains his knee, maybe because of excessive use like sports injuries or trauma or any other degenerative disease, the various structures in the knee joint starts to get degenerating or it gets worn out. So generally what happens is, when your knee cartilage starts getting worn out, the patient starts developing pain. Most of the people, when they develop knee pain, wait for a few months, like 3 months, 6 months. They won't attend any consultant, and they take treatment on their own and come to us when it is severe, which is not a good thing. Whenever a patient has knee pain, it's better to consult within 4 to 6 weeks to an orthopedic consultant. So what are the treatment, what are the remedies to avoid these knee pains in young age group? How do we avoid these knee pains in young population? First and foremost thing is lifestyle. Most of the people won't do any exercise. So that is one of the main cause of knee pains in young age group. Second thing is excessive use of your joint more than its capacity. Like in a day you want to get fit, in a 2 weeks you want to develop your abs, in a 2 weeks you want to develop your muscles. That's not the way it works out. Most important thing is warming up before doing any exercise or before doing any sports. So taking proper care of your joints and muscles and doing good regular exercise is important for the normal maintenance of your knee. Next thing is lifestyle modifications, like maintaining a good diet, nutritious diet, using supplements. We generally, when you consult a doctor, we advise the supplements, which is nothing but glucosamine chondroitins, which gives good healing of the knee joint. So one thing is excessive using of your knee should be avoided. Doing regular exercise is important. When patients develop excessive knee pain, they come to us for the treatment. Once they approach the consultant, we generally see the patient clinically, check him, get an imaging done, check clinically, and diagnose what is the problem. Generally 80 to 90% of the knee problems in young age group can be treated with rest, physiotherapy, medicines, and good lifestyle changes. So what do we do when patient approaches? First and foremost thing, when they come, we check clinically and we find out what is the problem. With the X-ray, most of the bony injuries we can make out, and if any patient has arthritic changes also can be made out. If needed further, we will advise the MRI of the knees. And once MRI is done, if the patient has a problem in his ligaments or menisci or in his cartilage, depending on that, we advise the treatment. So once your problem is diagnosed, depending on the part of the injury, like whether a ligament is strained, injured, a meniscal is strained or torn, or cartilage is worn out, we advise you the treatment. So these are the common causes of knee pain in young adults, which are nothing but not doing regular exercise, not maintaining proper diet, sports injuries, trauma, and degenerative changes. These are the problems with which patient comes to us. So if you have such problems, you can consult an orthopedic doctor and take his suggestion.